Hello and welcome to Dialogue. Chinese health services in some areas are under pressure as thousands tested positive for COVID-19 in one day. What's the reason for the most recent surge in cases? Facing the serious challenge, will China continue its zero-COVID policy? And finally, when will China fully lift its COVID restrictions? To take a closer look at the situation, I'm glad to be joined today by Dr. Chen Xi, Associate Professor of Health Policy and Economics from the Yale School of Public Health, and Hu Naijun, Associate Professor in School of Public Policy and Management at the University of Chinese Academy of Sciences, and later on, Dr. Jerome McCain, Director General of the International Vaccine Institute. That's our topic. I'm Xu Qingduo. Welcome to the show, gentlemen. I will start with Professor Hu. We see on Tuesday, we recorded more than 5,000 cases in one day. So people say this is the highest in about 2 years. So what do you make of this sudden surge of the cases?
Well, I think according to the official resources and data, we can see that the majority of the newly found cases are Omicron BA2 variants. That is to say, this kind of variant is, in my opinion, is transmitting very fast. The velocity of the transmission speed is out of our expectations. And also, a lot of people are, although they are infected but without symptoms, that is also to say it is very difficult to locate the people who are really infected. So I think all these factors make it the situation like today that thousands of newly confirmed cases are surging in different cities.
Mm-hmm. Dr. Chen Xi, how serious is the situation?
So with the more transmissible Omicron variant, especially the BA2, which is more spreading more quickly, so which leaves less time for people and for health authorities to respond. So this means that the spread may happen at a larger scale. So it's very important to maintain the conventional public health measures and wrap up the vaccination campaign and other measures. So far, I think it's still under control. At least with conventional public health measures, China has been slowing the spreading. So I think we should keep the momentum and restrict the virus spreading to a smaller scale. This is the essence of dynamic zero, because it may take some harsh measures for lockdown at some districts, some communities to disrupt individuals, communities, or cities at a very small scale, but allow the rest of the economy to continue without the risk of further outbreaks.
Mm-hmm. Well, Professor Hu, do you also see, both of you mentioned about the transmissibility, because the Omicron spreads fast, probably faster than the Chinese expectation, let's say. Do you also see other factors may play a role, like we are somehow, because for quite a long time, there's basically zero infection. Somehow people maybe let down their guard, or people have this sense of fatigueness. We have been here too with restrictions for too long time, without much infection, so it's okay for just walk around and do things as usual, and that may contribute to the infection.
Well, in my opinion, I think it is also under time that is very dangerous, because we are just after the Spring Festival holidays, and we are also just finished the Olympic Games holdings. So I think this time is also the peak of transportation every year in China. Mm-hmm. And I think this is spring, the seasonal transition from spring to summer. So I think it is also a peak time for even not the COVID-19, but the common flu. So I think all these factors has contributed to this kind of contagion, the surge of the virus. But I also think that I don't think people or our measures have some problems, mm-hmm. because as we all know that our responses to this resurgence is also, I think, very common, and also the situations in different cities, we should say they're not the same. They are in different situations. For example, in Shanghai, we can see it is the problem of quarantine hotel. And we also see in Jilin and in other regions, this is the problem of the border control. So I think right now, yes, we have to say Omicron variant BA2 has contributed to this, and the season, the time has contributed to this. But I don't see any kind of institutional, or we should say systematically problem we have found. I don't think with that.
Well, Dr. Chen Xi, China has followed we call it like a dynamic zero COVID policy. Can you explain to our audience, what is the policy and how does it work?
So China's zero COVID policy has been shifting and slowly shifting according to the virus, the nature of the virus, especially the coming new variant. So originally it was absolute and quick clear of infected cases in a very short time window. But with the more transmissibility of the virus coming to China, China has been slowly changing that to dynamic zero COVID. And dynamic means that it will take time for certain regions, communities to clear their infected cases. But eventually it will also achieve zero COVID at the society level. So this is different from another strategy in the public health arena, which is called a mitigation strategy. Mitigation strategy is like slow the virus spreading, but to a large extent coexist with virus at the society. So it's different.
Well, Professor Hu, obviously in China, the reason, major reason, China basically largely realized, zero or very low infection of COVID throughout the nation. Part of the reason is like the rapid and large-scale testing. But now we have this, Omicron, the subvariant BA2 is very transmissible. Are we adopting new measures or different practice here?
I think we must take the considerations of the newly introduced measures, such as the antibody test. As we all know that just several days ago in China, it is allowed to use the antibody test box for the people to test the virus at home. So I think this is a very important step in our measures change, or we could say in our future transform. I think the antibody test is very fast and it's very convenient. It is easy for common people to use. I think as you have mentioned, that with the Omicron BA2 variant, we must make sure the test is very quick. So I think the antibody test box that has been taken into consideration is, in my opinion, very important measure in deal with the Omicron variant.
Now we have Jerome Kim, the president of the International Vaccine Institute. Dr. Kim?
Yes.
So now we have a new surge in China. We have this basically a daily infection. It's a new record, like 5,000, more than 5,000 on Tuesday. So what do you make of the situation in China?
So I think, Omicron is a different variant, and things that have worked in the past in many other countries have not been sufficient to control the Omicron variant. So, China, like many countries, will probably be faced with a decision in the upcoming weeks, which will be, 3 courses. You could try to stay the course of zero COVID infections, which has proven very difficult because of the speed of transmission. The second course is a controlled release, kind of like what they're trying to do in Singapore and in Korea. And the third would be, something I don't think China would attempt, which would be to release all controls and let the infection run its course. But there are many things that China can do to minimize the impact of COVID infection, even if the zero COVID policy is not followed.
Dr. Chen Xi, so basically we can continue the practice with, of course, this antibody test, and then, the dynamic zero COVID policy can still be effective?
So I think in the near future, I think we still would like to achieve some kind of dynamic zero COVID, because China is not well prepared for this BA2 variant. the key is to vaccinate the older persons, especially people with more chronic conditions. I think there are still a large number of older persons at higher risk, not fully vaccinated. So I think the dynamic zero COVID may phase out eventually, but not at the cost of risking the high-risk population's safety. So it will take time to vaccinate them, especially now the international community has been discussing even the fourth dose of vaccine may be necessary. So given China's large population, 1.4 billion people, so it will take time to vaccinate the older persons with high risk, and also to distribute the antiviral drugs and also the antigen tests. And secondly, it will take more time to prepare the healthcare system, because we know that China has been reforming the healthcare system in the last 10 years, but the family doctor system has not been fully built. So when patients are falling ill, they tend to go to hospitals. This may let the hospital system be having a very high pressure and may overflow the healthcare system. So it will also take time to build such system to integrate primary care and the hospital system to better, more efficiently tackle with people, with large number of people without a symptom, especially in the case of this new variant.
Speak of the healthcare system, Professor Hu, right before the latest round of surges here in the mainland, in Hong Kong, we witnessed this also worst scenario in a couple of years in Hong Kong. Is there any similarity between the two locations, like in terms of the surge? Or Hong Kong basically has a better, I would say, healthcare system than in the mainland, but still it's a bit overwhelmed.
Well, I think as the professor have mentioned that it is a kind of a hierarchy healthcare systems. I think Hong Kong system is more or less the same with the United Kingdom or other European countries. They have this kind of first tier primary care and secondary care, etc., etc. But we must keep it in mind that right now the key of the measure is to the people who are without any symptoms or who are merely with very not severe symptoms. I think in Hong Kong or in European countries or in UK, United Kingdom, they will have their home isolation. But in China, that we want them to be collectively isolated, not in their homes. So I think this is totally different attitudes or measures, in my opinion. So I think in Hong Kong, just you have mentioned, the ICUs, the hospitals may be overwhelmed, but these are the people with severe symptoms. As to the people without severe symptoms or without symptoms at all, they will have isolated at home. But in mainland, in China, especially in some cities, for example, in Jilin, in Shanghai, in Dongguan, or in Shenzhen, a lot of people are with not severe symptoms, without symptoms, but they still have to be isolated collectively. So I think that is the problem we have to face right now. We have to build more cube isolation rooms for these people in mainland. That is, I think, in my opinion, the systematical difference between mainland system and Hong Kong system.
And the Hong Kong system. So Dr. Kim, Professor Chen, she mentioned earlier, like, if you, look forward, China, we have to somehow move probably to a stage that is, slightly different or different completely from this zero COVID practice. You need probably a combination of measures, for example, vaccination. Do we need the fourth dose of vaccination?
So I think that the professors have it exactly right. That, if you think about the different lines of defense, the first line of defense is what physical distancing you can do. That includes masks and avoiding crowds, and goes all the way up to lockdowns, depending on how severe the condition is. And lockdowns, it's important to remember, just buy you time. And in that time, you need to set up the second and third layers of defense. The second layer of defense is vaccination. And this would mean vaccinating, and in many places it would be vaccinating with an RNA vaccine or a protein vaccine like the one that Clover has. significantly boosting not everybody's immunity, but initially targeting the people at greatest risk for bad outcomes. So those would be the elderly, say everyone over 65 or everyone over 60 should be vaccinated, and there should be no exemptions because that population will crowd the hospitals. The third line of defense, again, was covered before. You need to have treatment. You need to have triage care so that people can be taken care of or isolated either in a group facility or at home and monitored. And then if they become more severe, then have access to the doses of medication, either the particular monoclonal antibodies that work against Omicron or with the drugs that prevent progression to more severe disease, all in an attempt to keep the intensive care units available for the people who need it the most. So it's a lines of defense. And, China is capable of building a significant number of additional rooms and capabilities. The healthcare system has to be prepared, though. And I think, I thought that the Chinese government is good at planning around these kinds of contingencies, and hopefully that planning has already taken place.
Mm-hmm. Well, Dr. Kim, you are located in South Korea. South Korea, Japan, China, we see Singapore, have a similar culture, sort of, like, people tend to view the virus or, the disease in a similar way. But their practice is, at least slightly different or different in certain ways. For example, in Singapore, they choose to live along with the virus. Despite the high infection rate, they are okay. What about the situation in South Korea? How do you compare like South Korea situation with Hong Kong, with Singapore, or with China?
Yes, so it's actually closer to Singapore with very high levels of vaccination. So among eligible population, so they're not vaccinating children yet, we have greater than 90% of people have been dosed. Over 60% of people, particularly the elderly, have received the second dose, a booster dose. Mm-hmm. So, and that despite a surge in the number of cases, right now ICU capacity is running less than 50% occupied, despite record numbers, and we're hoping that this week is the peak. So like many places, Omicron goes through fairly quickly, peaks and then recedes. And the modeling would suggest that the peak is coming very shortly. And hopefully the hospitals will remain accessible and ICU beds will be available and care and treatment will be available. But Korea used a very interesting system of home monitoring, particularly now. And, they made a decision that when the Omicron outbreak reached a certain level, that the current system would not be sustainable. And at that point, they had prepared for what we're experiencing now.
Mm-hmm. Well, Professor Hu, look ahead for China. Of course, as I said, we have to probably, at a certain point in the future, move beyond this zero COVID practice. And what conditions do you think the government is confident and the public is confident that, okay, now we can live along with the virus? Because some would say the virus will never leave us anyway.
Well, I agree with a guest that has spoken about the vaccination and the preparations that we have to take. That is to say, first of all, we have to be ready ourselves. That is to say, we have to vaccinate the majority of the people, and we have to vaccinate the elder people, the second dose or even the third doses. And then we have to prepare for the facilities, such as hospitals, such as home monitorations, and we have antibody test systems, etc., etc. And then I think it is also depending on the virus itself. We must see the dramatic decline of the mortality rate, the severe symptoms rate, or even ICU rate. So if we, from ourselves' point of view, if we are ready, we have the majority of the people have to be vaccinated. We have prepared for the facilities, and then we can see if we see the decline of the mortality rate to a certain milestone or standpoint, then we can say that we are fully ready or prepared for the next step, or even fully open to the outside world.
Mm-hmm. Dr. Chen Xi, speak of the virus or the new variant. We say the BAT of Omicron, which is more infectious but less lethal, and of course now people are talking about Delta Cron. How much do we know about the new variant or possible variant, probably from the existing ones?
Yes, so with the COVID pandemic, the Omicron will not be the last one for sure. The virus has been evolving and it may become more dangerous, but in past human history, viruses tend to transmit more and becoming less lethal. So this is the trend, but I think we still need to do the genetic testing about each of the new variants to make sure it's not surpassing the previous virus variant in terms of its virulence and as well as its transmissibility. I think to trace the new variant will be very important target even after this pandemic for a long time period. I think that this system, surveillance system, has to be built. But I think so far, our focus should be on the new variant BA2 to vaccinate those high-risk people. Because if you compare Hong Kong with Singapore, New Zealand, all those countries, I think what's worrisome is the older person's vaccination rate very low, much lower than the younger age adults. So that's the key to make Hong Kong like suffering from a much higher case fatality rate. But as long as countries similar in culture to the place like Hong Kong, but after their vaccination of the high-risk populations, I think gradually the case fatality rate will be approaching the common flu. So this is already happening in Singapore, happening in UK and New Zealand, those countries. So I think we can still see the silver lining and the light at the end of the tunnel.
Well, Chen Xi, you are located in the U.S. We know that, well, U.S. officially, they are not saying they are completely open because there's obviously extension of a mask mandate for another month until mid-February, April, slightly different from the practice like in the UK or other European countries. What is the consideration of extending the masking?
So the U.S. health authorities has an assessment about the local community risk. If the risk is still high, they mandate mask use. And I think they leave much of the responsibility to each individuals. So I think something China can learn from American experience in terms of leave some of the responsibility to the general public to make decisions. For example, the recent approved rapid antigen test in China will make the test kits available to each individuals. I think this will be a very important step to at the individual level identify the risk and identify the infected cases and trying to treat that at the first available time, because the earlier treatment means the lower chance of hospitalization and deaths. So I think China could also think about prioritizing some of the high-risk area by sending the free rapid antigen tests to individuals. The U.S. have been using big data to mail some of the antigen tests to individual home and ask them to test. That will isolate the infected cases from the rest of the community. It will be very efficient. Otherwise, according to some experience of the general public, some people are hesitating to go to the pharmacy to buy the antigen test because they worry that if they have suspected cases, they thought they could be treated as real COVID cases. So they worry if they should go. But if they have this at their disposal, they can test at home. Then they can report to the health authorities for sure that whether they have a COVID case.
So, Professor Hu, we should, in China's case, we should make it more available for the antigen test, probably for every family, every individuals.
Well, I think, yes, it is, in my opinion, a very important step forward for the Chinese system to get this antibody test at home or individual level. But I don't think we need to be test for everybody to have test. I think I agree with the guest that has spoken about the danger or we can say people with dangerous environment or with high risk or middle risk areas, or people are isolated at home, for them to test this, in my opinion, is enough. We don't have to have everybody to test every day. We have to be give the responsibility or give individual a chance to judge whether they are in dangerous situations or whether areas are in high or medium risk. So I think we have to give people their own responsibility or choices to make sure whether they have to be tested.
To make it available for those who suspect probably, all the, whether I'm having a cold or I'm got, the virus, so you can have a test probably at home. It's easier. Well, Dr. Kim, if you look at the situation globally, I remember, we had a goal basically to vaccinate the global population, like 70% of them at the end of the year. Where are we? Do you think we would do that?
So, by now we're around a bit over 60% have received at least one dose. Unfortunately, again, in the poorest countries, we're still over 80% of people have not received a single dose in the low-income countries. In those countries, though, and this is an important part, we talk about the vaccine gap, but we have to talk about the diagnostics gap. We don't actually know what percentage of people have actually been infected, despite not and are not vaccinated. So in some of the places that we're working, we're seeing prior infection rates well above 85%. So there were infections there that we just didn't know about. Now, those people have some protection against COVID-19 and against Omicron. They will still acquire infection, but like a vaccination, prior infection provides some layer of protection against disease. What we do know, though, is if a person has had an infection and is vaccinated, and this is data from that Chinese company Clover that is testing a vaccine, the vaccine adds another 60% efficacy on top of the protection already provided by infection. So, yes, we still need to continue vaccination, and we need to work with countries around the world. And I know the Chinese companies Sinopharm, Sinovac have been major providers of vaccines for global health.
Dr. Kim, back to China, what's your suggestion, to the Chinese government, like what we need to do from the central government level or from this provincial government level or the city level, move forward from now, like to reduce probably the reliance on this zero COVID practice?
So I think, and your other guests have covered this as well, I think, vaccination initially of the key target populations, those at greatest risk, as quickly as possible, and potentially with what we call a heterologous prime boost, so mix and match. So not necessarily an inactivated vaccine, but one of the other vaccines that China has available. Second, I think I would get prepared to provide the kind of medical care that is going to be necessary as COVID cases increase, and as a certain percentage of those people will have severe infection, will be hospitalized, will be put in ICUs. And that can be modeled from data that many countries have been publishing that will apply equally to China. And then finally, to have those medicines available and to have the system for healthcare. So, and this is something that, is difficult if you're used to a fixed healthcare system, to have people at home monitoring their own symptoms. You have to make sure that the system that responds to them, that identifies people who need more care, is working. And it may be a phone-based system or a mobile phone-based system, but all of that needs to be prepared, because you don't want to be in a situation where people, unfortunately will be dying at home. And you really want them to have access to the kind of care that a Chinese citizen can get when they go to the hospital.
Well, thank you, Dr. Kim. With that, we come to the end of today's show. Many thanks again to our guests. You can also watch us on the CGTN app or on YouTube. I'm Xu Qinduo. Thank you for being with us. See you next time.